One of the great things in Qatar is that we have so many different cultures, and I think we need to be proud of that fact. The other issue is that Qatar is a mix between traditional cultures and the more modern. And we need to embrace both when we're providing healthcare services for the people of Qatar.
We are depending on our wealth, which is oil and gas. In the future, we are going to depend on our people as a new wealth, and actually our people has to be healthy. So in that sense, the National Health Strategy is a major part of Qatar National Vision 2030.
The importance of National Health Strategy comes from the National Health Vision 2030 for the country, which commits to a healthy population, both physically and mentally, through a provision of comprehensive world-class healthcare system.
The National Health Strategy 2011 to 2016 is one of 14 sector strategies of Qatar's first national development strategy. It aims to achieve the 7 goals defined by Qatar's National Vision 2030.
The people of Qatar, they will see that there is a comprehensive system. Wherever they need something, they will find it, and they will find it at a quality.
Easy, affordable, accessible healthcare services where they want it and when they want it.
They always demanded quality, they always demanded the best service, and they will find that.
We have promised the public of Qatar a world-class health service, and we plan to deliver that.
You need to have a holistic kind of approach. You need to organize it, you need to put the resources in place to achieve the maximum impact.
Primary care services, secondary care services, tertiary care services in a continuum, in a very natural flow. And all the people of the Qatar would have access to medical care just like that.
There will be more focus on self-care, health promotion, health prevention. We'll try to avoid crowdness unnecessarily in the health sector by having more education, more information about their health. They can take care of themselves by self-care model. They will only go to hospitals or to primary health care centers when it is needed.
Behind me is, you see here, there is a student from Cornell Medical School, and this is part of training, part of future generation of the doctors.
We need to have the skilled workforce. If we don't have the people to implement this strategy, it'll just stay as a piece of paper and we can't get it implemented. We have to have the right people. That it has to be a coordinated effort. This cannot be seen as a Supreme Council of Health strategy. We all have to work together to get this done. It is too big. We have 35 projects. We need a framework. We need to know where we fit in this healthcare system. Everyone has to work together to get this done.
The benefit of moving from tertiary care-based system to a primary care-based system has multiple advantages. Cost and financing, which makes it much better and much cost efficient.
Investment is a continuous process, and we're trying now to make sure that we are investing, not spending. And by saying that, we need to invest in the right place with the right quantity and quality in terms of infrastructure or human being.
Investment is very important. Human resource is the most expensive thing. We need to invest heavily on them. And the second most investment is the future assets, which is researches as well. We are here working to help the patient in one pathway, the same diagnosis, same treatment, all will have similar results. So the research investment is very important here, not to help just Qatar, but to help the whole Middle East region.
This is the first time that a national health strategy was written with involvement of all stakeholders, some 40-odd organizations on the table at different levels.
There has been an excellent consultation approach. It's not simply a case of bringing in a group of experts from outside who develop a plan and then leave it. It's very much the product of all of the key stakeholders in the country, and I think it gives a better chance of a successful implementation.
When it comes to implementation, you have all the people, stakeholders who have already bought into it. So they're passionate about it, they own this, and they are going to be involved in implementation of it very successfully.
If anybody can do it in this world to produce the best system, actually it's us in Qatar. You need the KPIs, key performance indicators, you measure them. And then you go back and you make people who are the managers and directors responsible directly. Not just institutions responsible, but individuals responsible for the implementation of these strategies.
Inshallah, I'm very optimistic that it would happen. If we implement it as it needs to be implemented, then yes.
6 years from now, change will be seen dramatically, and that Qatar, as a healthcare system, will be a reference system, at least within this region.